Sjogren's patients is basically the SSA and SSB antibodies. So there are some patients, as you know, who were diagnosed with Sjogren's before the guidelines came out that had the lip biopsy and it was positive, but without the antibodies. So we know that the SSA and SSB antibodies are the major risk factor. Along with that, obviously, we also review the other, what we call comorbid conditions. So if they have, you know, a history of radiation therapy, all the other things that may predispose them to have lymphoma. But the main thing is basically your close relationship with your rheumatologist, with your dentist. So a couple of my patients who've had lymphoma actually presented with parotid swelling. So it's not something that would happen overnight. It was something that would happen sometimes months, sometimes weeks, but you need to pay attention to it. And you and your rheumatologist and your dentist need to basically be aware of these. Because it's a cancer, so any other systemic symptoms, so obviously any weight loss, night sweats, you know, things like that that are out of the ordinary needs to be further evaluated. We don't necessarily suggest routine imaging. If there's anything else that's a little bit unexplainable, then we may have to do additional imaging and laboratory investigations, but it's basically something that wouldn't happen overnight if you are being closely followed by your rheumatologist.